Okay, so when we were inspecting Daenerys, I did note that his septum was not deviated, it was midline, there are no polyps noted, and next we will move on to the mouth and throat. So first I'm going to do a general inspection of his lips. There aren't any ulcers, no discharge, no lesions of any kind. I'm going to test cranial nerve 12, which is his hypoglossal cranial nerve. I'm going to have him stick his tongue out. Okay, good. And it was symmetrical. There weren't any deviations there. So next I'm going to have him open his mouth. Okay. I'm just going to generally note the mucosa, the color of the tongue, make sure there aren't any lesions. I'm going to get our scope. Open him up again. I'm going to note that the tonsils aren't swollen, that the uvula is midline and not enlarged. So here's open him up. Say ah. Okay. And that tests cranial nerve 10, which is the vagal nerve. The soft palate should move when it says ah. Okay. So next we're going to test the gag reflex. Say ah again. Okay. One more time. Okay. Very good. Okay, opening up one more time, lift your tongue up. Okay, and we're going to note that the lingual frenulum is midline, and we are going to just take a look at the Wharton's ducts, also known as the submandibular glands. So we're going to note his overall dentition, look for any dental caries, any signs of gingivitis. And his mouth, his hard and soft palate, his gingivitis, his tongue all appear to be very good. Next we are going to do a neck exam. We are going to start with palpating the lymph nodes. So we are going to start with the pre-auricular, which is right before the ear, the post-auricular, behind the ear, the occipital, the condylar, the submandibular, the submental under the chin, the superior cervical, the posterior cervical, and then to do the deep cervical, I'm going to have you turn your head towards your left shoulder. Okay, and then towards the right. And then the supraclavicular. Next, I'm going to have you look up, and I'm going to assess his trachea, that it is nice and midline. I don't see any lesions or nodules noted. I'm going to check his thyroid, and have you swallow. And you should feel it pushing up against your fingers, which I did, and there weren't any nodules noted. Next, I'm going to check cranial nerve 11, which is the spinal accessory cranial nerve. I'm going to put my hand on his shoulders, and I'm going to have him spread his shoulders against my hands. Okay, and then I'm going to have you turn your head against my hand, and then again in the other direction. Very good. Okay, so now I have my stethoscope, and I am going to assess his carotid arteries. I'm going to do just one at a time to avoid making him feel dizzy and pass out. I'm going to start on the right side. I'm going to feel. feeling for any pulsations and also feeling for any thrills or heaves. And then I'm going to feel on the other side and make sure that it's symmetrical. And then I'm going to listen with my diaphragm for any bruise. The diaphragm is generally better than the bell for picking up any bruise. I didn't notice any swishing or bruise. The next thing I'm going to do is assess his shoulders. First I'm going to generally feel the joints. First actually I would inspect again to make sure there weren't any lesions or obvious deformities. Then I would check the range of motion. And we're just going to do one side, but I would do both sides to make sure that it was symmetrical again. So I'm going to have you take your right arm and extend it over your head. Test for flexion. Now put it down and behind you for extension. Okay. And now I'm going to have you move it away from your body for abduction and then towards your body, across your body for adduction. Next, I'm going to test internal rotation, so up and behind you, and then external rotation, put your arm like this, and then up towards the ceiling. Very good. Okay, so the next thing I'm going to do is inspect the rest of his arms, and there aren't any obvious lesions, deformities, no atrophies, no nodules noted in his fingers. I'm going to feel his elbows and the fingers, and there aren't any abnormalities or nodules or deformities noted. I'm going to assess his brachial pulse as well as his radial pulse, and I would do that bilaterally to make sure they were symmetrical. There's no irregularities noted in any of his pulses. Next thing I would do is assess his nail beds, make sure there wasn't any cyanosis or clubbing of his fingers. I would test his capillary refill. I would compress a nail until it blanches, and then let go, and the color returned in less than 2 seconds, which is normal. Check the other side. Very good. Okay. Normally I would be doing this exam without his shirt on, and I would also be checking his axillas and checking for the lymph nodes in there. And with all of the lymph nodes, we would be making sure they were mobile, non-tender. Anything that was tender or non-mobile would need further investigation. The temperature of his skin is a good temperature. Okay, so next I would check his epitrochlear lymph nodes, which are right in here. And then I would just do some basic maneuvers just to test his shoulders. So I'm going to have you put your arms straight out, and I'm going to check his supraspinatus strength, push up against my arm. Okay. Now I'm going to have you put your arms like this, bend your elbows. Okay, try to push up against. Okay, good. Okay, now arms like this. Okay, now try and turn your wrists outwards. Good. Okay, now put your arms straight out and lower them slowly. Very good. Okay, next we're going to test the range of motion of your elbow. So I'm going to have you bend your elbow for flexion and straighten your elbow for extension. I'm going to have test supination, turn your palm face up, and then pronation face down. Again on the other side, bend your elbow, straighten, turn your hands straight down, and then straight back up. And next we are going to check your fingers. And again, there are no nodules noted, no tenderness noted in any of the joints. Okay. Try and open your hands. Okay. Now try and keep your fingers open. Very good. Okay, so next we are going to check his wrists. Very good. No tenderness, no nodules noted. Okay, we're going to test flexion. I'm going to have you point your fingers towards the floor. Extension, point them towards the ceiling. Abduction, point them away from yourself, and then adduction. Very good.